Hi, good evening, everyone. Welcome to Silence the Shame Presents a Community Conversation World Health Day. This is a Q&A. So if you have questions, please type them in the chat and they will get them to me and we will try to address them. But I wanted to let you guys know April is National Minority Health Month. So thank you on behalf of Silence the Shame. And I just want to make sure I covered everything, all the housekeeping, but make sure you do type your questions if you have any in the chat. This is going to be interactive. And today we have with us Dr. Jayne Morgan and Jewell Gooding. So ladies, if you could please introduce yourselves, that would be fabulous. Starting with you, Dr. Morgan.
Hi, it's a pleasure to be here. Thank you for the introduction. I've always admired Shanti Das and her work with Silence the Shame, so I am really honored to be included today in this panel. I serve as the Executive Director of the Covet Task Force for the Piedmont Health System. I am a cardiologist by training, have worked in this area of COVID since the COVID pandemic, as many people have been pressed, especially within the hospital systems and within the medical establishment, into multiple roles regarding COVID as we sort of try to source our resources and also keep patients alive, patients safe, our staff alive, our staff safe. So in this role, I bring all of the expertise regarding the COVID vaccines, not only to Piedmont, but to our greater community, what these vaccines mean for Black and Brown communities, but also for the medical community to help people understand them, to provide education, and to have greater community engagement. I also look at data and research across our system that allows us to better understand the population that we serve, not trying to treat them as they hit the emergency room door, but understanding that our real treatment and healing and care for our community begins when they are out living before they come to the emergency room, such that we can begin to understand them, decrease readmissions. And so that's my role, sort of a big topic. And as always, COVID continues to change and evolve, and my role as well continues to evolve.
Thank you so much. Jewell, and we'll go with Gabriel last. Go ahead.
Thank you. Yes, my name is Jewell Gooding. I am the Executive Director for Silence the Shame, so very excited to be here. Just a career history of mental health. I am professionally trained as a clinician and have done so for about 7 years, moved into state government and public policy, worked very well as a mental health advocate. I myself am a person with a mental illness, and I'm also a parent of a child with a mental illness. So just have a very broad aspect. So we'll be coming from different perspectives as we talk about mental health, particularly, and what we need to do to really focus on this post-pandemic era, particularly in our Black communities. So thanks for having me today.
Thank you. And Gabriel Maldonado, please give us a quick introduction.
Hi, everyone. Gabriel Maldonado. I'm the founder and CEO of TruEvolution. We are a community health and social justice organization based in Southern California. We're in Riverside, serving Riverside and San Bernardino County. We consider ourselves a community-based org, so we provide a host of social services and some clinical services, including HIV care and prevention services, case management, testing, linkage to PrEP. We have a mental health clinic, so mental health is also a big pillar of ours. We have an emergency housing program, and most recently we became housing developers. So we're now building housing in our local community.
Wow. Okay. That is really amazing. So first I want to say Black Americans are 2 to 3 times more likely to die from COVID-19 compared to white Americans, and when the age is taken into account. So the horrible thing is that that's the stats, but now we are slowly, God willing, moving into post-pandemic era. And I think that all of us here, we're very aware of all the different things that everyone else is now finding about Black healthcare. So that's what we're going to talk about today. Jewell, can you give some information about how Silence the Shame is helping the community with this prolonged grief disorder that I'm hearing a lot about?
Absolutely. So, just kind of taking a step back, We've all experienced kind of just dueling crisis throughout 2020, right? And really thinking about the collective trauma that we're experiencing, whether that is directly or indirectly. When we think about job loss and we think about death, there are a lot of losses going on, right? So it's not even just singled to death, right? It's the loss of our what we felt was our normal and typical lives, right? There was a lot of things that was missed, particularly with our students and young people, graduations, but you also have those who had canceled weddings and all types of different things that have taken place. And we still had regular life, right? So that still kind of took place, and recognizing that our lives was just so different and so much changes have taken place that we're still kind of in survival mode. We're going to get to a point where we're shifting from survival and now we're moving into recovery and we're healing, right? But at that point too, that's when everything will probably really compound and allow us to feel kind of that additional pressure and really trying to figure out, how did I make it, right? And how do I get to that next step? So with Silence the Shame, what we're doing is providing education, awareness. I think making folks aware that this may be coming, right? I'm not saying that it's a, cause and effect, that it will definitely happen, but just to be aware of it, right? And to recognize that where our peers, where we're thinking things are good and we're smiling and we're going back into the workplace and we're thinking we're all okay, right? Even if we're vaccinated, there's still a lot of anxiety that's going to come about, and making sure that as we are transitioning and we are shifting into a more typical routine, that we understand what that looks like. So giving workplaces guidance in regards to that, helping them to understand what that may look like, even preparing for the ongoing crisis that we face. And the structural racism, that is not an overnight problem, right?
No.
Or solution. This is going to be an upheaval of everything that we have believed in. So that is going to be a lot to process at the same time too. So really being able to make people aware of it, providing the educations and strategies and collaborating with strategic partners across the world, just to really capture ways to understand that and how we can best prepare for that. Working and collaborating with school systems and providing like crisis and de-escalation training, such as mental health first aid and question, persuade, refer, which is a suicide prevention training. We're trying to engage college students with our college ambassador program. We also want to develop and work with Black leaders, right? Aspiring and young Black leaders, as we are really trying to really get into this recovery phase, to equip us with the tools we need in order to combat that secondary crisis that we're going to be facing. So those are just some of the things that we have started to really implement and engage and connect with different communities. We've continued our ongoing outreach, whether that includes our community conversations like today, whether that is our podcast where we are talking with different experts and really giving us that ongoing information. We also have just our social media work. So we're going to be doing a lot of engagement where we're doing mental health mornings. We're going to do self-care Saturdays. We've been doing that for the last 2 years, where we're engaging folks in prioritizing their wellness. So all of these wellness strategies, really helping folks to understand, and education is really what we're trying to do to empower our communities overall.
So I want to let you guys know, prolonged grief disorder is a medical condition in which grief symptoms last longer than 12 months. Without treatment, the condition can persist indefinitely and new symptoms can emerge. And what they're saying is this prolonged grief disorder can be a precursor to depression, substance abuse disorders, physical illnesses, especially cardiac disease and immune system related diseases, and cancer. So it's really important. I think that because we've been locked down, and even I have said it myself, because we've been locked down and you haven't been able to see people, the people who have died, I don't miss them the way I should miss them because I haven't seen anyone. But then when we start, getting together again, I've lost several family members. When we get together as a family and certain people are missing, it might hit me like a ton of bricks, because it's just you've been isolated for so long. So it's going to be very interesting, but I'm glad that we do have resources out there to help us to get through this. So Gabriel, how is the community with TruEvolution, how has your community that you serve been impacted by the pandemic?
Thank you for asking. We are in Southern California, but we are in one of the largest jurisdictions, federal jurisdictions under HRSA, the Health Resources and Services Administration, which is how a lot of our federal funding for what we do comes down. We're the largest jurisdiction in the US. So we're about 27,000 square miles. So we're a combination of rural, suburban, and urban geographies. And that creates a real challenge when you have something like COVID-19 and you're trying to facilitate the access to services, access to transportation, locale to emergency services. And then when you talk about housing, which is our biggest mantle right now, it creates a real strain and challenge on the housing system when you have such a large geography that you're covering. So like a lot of jurisdictions, we've been struggling. But what I really am hopeful for in our area is that our local county and Riverside County has done a lot to really strengthen and coordinate between community-based organizations in the nonprofit sector. And I see a lot of hope and innovation, and I see a lot of creativity coming out of the approach of really empowering local community organizations to do the COVID response work. So there is hope in the chaos.
Thank goodness, thank goodness. And I know California, along with Georgia, has been quite a hot spot as this whole pandemic has been going on. Just watching the MASH-like, things going on in the parking lots of the hospitals because they just ran out of room. So yeah, I know we are so grateful that we have a vaccine. Dr. Morgan, I know you've been on the front lines during the pandemic as the clinical director of the COVID task force in one of the hotspots for COVID-19. Can you talk about how things are hopefully going to be changing post-pandemic?
So one of the things, that we are anticipating as we shift sort of into this third surge is that now that we have about 75% of the population that's 65 and older vaccinated, the younger population heading out to spring break, we are expecting to see not only a surge, but a significant decrease in the age of patients coming in, because the elderly now, by and large, have a great degree of protection. And so we start to see this younger and younger and younger age group. And then that younger and younger and younger mindset of that invincibility, the impermeability. And so one of the things, obviously, that we have recognized in this COVID pandemic is that people who are younger and people oftentimes who have, excellent health tend to have a less aggressive course of COVID. In fact, they may just quarantine at home, may not have any symptoms at all, really just sort of playing video games, marking their time for 14 days until they're free, right? But what we've noticed is that 30% of all patients who are diagnosed with COVID end up with long haul syndrome, meaning that even after they seroconvert back to negativity, COVID negative status, they can develop symptoms, neurologic symptoms, taste and smell, brain fog, disorientation, and things even more serious, inflammation of the heart, like myocarditis or inflammation of the lungs. And what we see is 30% of these people develop this independent of the severity of your disease. And so while we are expecting more and more younger people or that demographic to shift down in age and perhaps have less complications with COVID, we're also anticipating that some of these patients, unfortunately, even though they were fairly asymptomatic during their COVID infection, may actually develop more serious symptoms down the road that will be more debilitating and perhaps even lifelong. And we're at this point unable to prevent it, unable to identify who's going to be impacted, but we do see it at 30% of the population. So the unfortunate part is you really could be pretty healthy during your COVID infection and then become sick later on. And that's the risk that we're going to see in the youth who's feeling, by and large, fairly cavalier. They're tired, as you can imagine. This is, they're in their youth. They want to be out. They want to socialize as much as we're feeling it. And so we are concerned that this is what we're going to face. And not that any age group is less important than any other age group, but obviously when you see younger and younger and younger people suffering long-term debilitating diseases, it's somehow more catastrophic and more traumatic for us. And so these are some of the things that we are concerned with as we move forward.
Okay. Yeah. Well, we do know that as of when we're doing this, the 16 and over are now able to receive the vaccine, the Pfizer vaccine. So that hopefully will help some people, because I do know I've heard a lot of college students that are very concerned about getting back into the classroom. So they are very serious about getting vaccinated. So I think that that'll hopefully help to maybe stop things a bit. I'm in Michigan and the numbers here have just went through the roof. And like you said, it is the younger population that is doing it. So, you know, I think that, I hate to say it, but, you know, we always have to wait a few weeks after. So a few weeks after spring break. So maybe sometime next week or the week after, we might see this unfortunate surge in the numbers. But like I said, I hope we are on the end of this. Please let us maybe have a summer in 2021. So recently, our founder, the Shanti Das, went to the ER, and she actually had to go a couple times in a few days and was treated just terribly, unfortunately. And, you know, she obviously educated woman and was able to advocate for herself and keep complaining, and she didn't quit. She did get sent home, but she went back and she was able to get the care she needed. She ended up needing care. It wasn't all in her head. It wasn't COVID-19, thank goodness, but she did need care. And so for people who don't have any clue about the healthcare system, don't have an advocate, Gabriel, I'm sure you've encountered people like this in your population. How do you help them and, you know, inform them on how to help themselves? Because as soon as you walk in the door, especially with your population, you're Black, and then two, you have a diagnosis that has a stigma attached to it on top of that. So, you know, what do you tell them? I mean, how do you guys help them?
Yeah. I mean, first and foremost, I would tell anyone and everyone that if you are privileged to have a community-based organization or an organization that is known and reputable for working with very diverse and culturally diverse populations, which a lot of communities do, you know, from Atlanta and Los Angeles to New York and Cleveland, you know, even in some of the areas that you wouldn't expect, there is your local org that you know. So, you know, go to that org, be plugged in, know what's in your immediate community. When you don't have that privilege, or when, you know, like my brother, who is a cancer patient and has very, very specialty oncology needs, there may not be that community org that has that resource and service. So, you know, the first thing is really expand your vocabulary is what I try to help my clients with. And what I mean is I'm talking about the health literacy vocabulary, being able to know the different acronyms and different state insurances, and just understanding what the different words are, I think is one really, really just basic, but huge gap in health literacy, is just understanding the alphabet soup, the different words, the vocabs, what they mean. And then secondly, providing the client with a path for remedy or a path to issue grievance. So most institutions, I would say any reputable medical institution, and Dr. Morgan can correct me, but every reputable medical institution would have a grievance process or some sort of profit process of issuing complaint. And so really being aware of what your grievance and what your process for issuing complaint is, I think those are just starting points, the beginning points to being able to advocate, because nothing the system understands more than the system. So, and often the population just doesn't know where the system ticks and how to make this click to that. And I think that if you're trying to, you know, win over the system, it's really having a fundamental understanding of how that system works. And it's really the job of community orgs and institutions like us and Jewell's organization to us be able to provide that advocacy, that awareness, that basic education. I think that is our charge, really, to provide that for our clients.
Definitely. Dr. Morgan, what do you think about that?
So, you know, I think it's, you know, without question, you can enter the healthcare system on any day of the week and, you know, and have someone pass judgment on you. just based on your appearance. And we have to remember that physicians, nurses, PAs also can be racist. Racists get all kinds of degrees. So they get medical degrees too, and they get law degrees, and they go into politics, and they become teachers, and they go into a lot of areas where they can do a lot of damage to people, where they have a lot of power. And even though, as physicians, we take a Hippocratic oath and we're supposed to, serve humanity selflessly, we take the oath, and then, you bring yourself to work. And who are you? Who really are you at your core? And oftentimes, people who have not grown up in cultures of color are unaware of their thoughts and unaware of their actions that are still racist, assumptions that are made, assumptions that we know that you don't need pain medicine. We know that you're just a drug seeker. Right. That type of assumption. I'm going to do the best thing for you and not prescribe you a lot of pain pills because I know that you will just sell them on the street. I'm going to make that decision for you. That's a racist judgment, although in their minds, they're protecting you because they have already assumed what you're going to do. So these are the kinds of things that I think, and quite frankly, I think, Shanti probably encountered that as well. And how many people can really advocate for themselves? We're talking about a system. It's very hard to advocate in a system. You certainly have bad actors in every system. But I think it is important, as Gabriel said, to be able to speak up, to be able to know some of the language. And that's not fair, because we shouldn't have to do that. You should be able to walk in and expect absolute top line care, regardless of whether you can speak the language of medicine, the acronyms, you've read something. That's just ridiculous. And yet, Gabriel is right. It will help you when you need to advocate for yourselves. And obviously everyone is not like that, but the fact of the matter is it does happen. The healthcare system is not an equitable system. There's not health equity in this country. And there's a reason for that. So I can't disagree with anything that's been said.
Yeah, it's unfortunate. And then because of COVID, when you can't even take anyone with you, it makes it, 10 times as hard because, she was obviously in pain, but at the same time, thankfully she could speak up for herself. But, we had a family situation and the person couldn't talk at all.
Right.
So we were like, what do you mean nobody can go with them? They can't talk.
That's right.
I'm sorry, COVID. And then you can treat them any kind of way because we can't go to the hospital either. All we can do is call. So, COVID really made things really, really, really difficult when you're trying to make sure that you're treated fairly. I'll just tell you the story. My father actually was released from the hospital. They lost his clothes. So he had no clothes, no shoes. And they had him in a hospital gown going to the rehab.
Right. And it's difficult, I think, when whites have family members in COVID that are admitted and they can't go in with them, that's an uncomfortable feeling for them. But when people of color have people who are admitted and you can't go in with them, and maybe they're not able to speak for themselves or advocate for themselves, that's scary.
Yes.
We're talking about fear. There's a big difference between what we experience, relinquishing our loved one to a system that we know historically doesn't always, mostly it does, but sometimes it doesn't.
Right.
Have our best interest at heart.
Yeah. And then you got other people getting sick because they're worried sick about who's in the hospital. I mean, it's just, it's a domino effect, unfortunately. But like I said at the beginning, I think we all knew that these things existed before COVID. It's just all of a sudden there's a whole lot of our counterparts that are like, wait a minute, I had no idea. And so now their eyes are open to it. And all I can pray is that there is changes coming, because from the top down, from government to hospitals, everywhere, changes have to happen because we all should be treated exactly the same.
Sure.
I actually posted today and said that, you know, it is a human right for you to not have to worry about your financial status, not to be concerned about your health. It's a human right. So hopefully we can all get treated the same, and we don't have to worry sick about what's going to happen if we're not right there. And if you don't have the knowledge that you need about healthcare and, you know, what they're saying, and if they're not explaining things to you correctly. So please, if you have questions, please don't forget to post them in the chats, and we will definitely be checking those.
Sure. And think about, you know, we are now, you know, 1 year into this pandemic. Within 1 year, the African American community has lost
Someone's at your door.
from our life expectancy.
How
So
many? I'm sorry.
3 years of loss of life expectancy in this 1 year. Again, not by happenstance. This is a social construct. So we now are expected to live 3 years less. We already weren't going to live as long, right, as whites. Now we've got 3 more years shaved off in 1 year of a pandemic that has exposed quite a bit of the social construct. So there's a lot of work to be done.
Yeah, I didn't know about that. That's very alarming. Which is all the more reason why I would love for you to please give some information to help us to become healthier post-pandemic. So God forbid, you know, because there are some of us that are not going to get vaccinated, but, you know, God forbid you get exposed. Hopefully you don't get sick, you know, too sick from it. But what are some of the things that people can do so that we don't have to worry about these underlying conditions? You as a cardiologist, I know, have thoughts on this.
Right. You know, obviously, I am a proponent of the vaccine. People with chronic medical conditions, or what we call these comorbidities. So if you have heart disease, lung disease, diabetes, cancer, high blood pressure, arthritis, rheumatologic disease, anything that you're just living with every day, or that you're taking medications for, that's what we call these comorbidities, these chronic medical conditions. You are more likely to have complications if you are infected with COVID-19 than someone without these complications. I'm a cardiologist. If you have heart disease and you become COVID positive, you're 6 times more likely to be admitted to the hospital. Once you're in the hospital, you're 12 times more likely to die. Is that worth that? The vaccine not only removes that, takes that completely off the plate. Don't forget, 100% prevention of death. That's really the main thing that we look at as scientists, right? Nobody died. Nobody. Just think about that. And 100% prevention of hospitalizations. So even if you were to get COVID, you're not that sick. And don't forget, it protects you from what? That long haul syndrome, which still could be coming. Even if you're one of the lucky ones who was happy-go-lucky, I've got COVID, but I feel great, down the road, it could be even more devastating for you. So if you have a chronic medical condition, you all are the ones primarily that we want to ensure get this vaccine. When we look at the Moderna, the Pfizer, the Johnson & Johnson briefing documents that were sent to the FDA, I read all of these documents multiple times. People with these chronic medical conditions were included in large numbers. People with heart failure, more than 3,000 people, lung disease, more than 3,000, hypertension, 8,000, diabetes, 3,000, cancers of any type, 1,400 people, AIDS, all of these people were in there, including people who also had COVID. So I think when we look at the compilation of these 3 trials, we're talking about 110,000 people. And even though these chronic medical conditions were not specifically studied in these trials, they also were not excluded. So we have data, all comers, bring everything with you. And we are going to have you in this trial. And then the last thing that I will say for people of color, Black people, even though we're 13.4% of the population, we're represented in the Pfizer trial at 9.8%, the Moderna trial 10.3%, and the Johnson & Johnson trial at 13%. That was incredible, because by and large, if you think we don't trust the healthcare system, let's not even start to talk about research and clinical trials. We don't participate there at all. And so these companies were intentional, they were purposeful in trying to be inclusive. So I think we should be confident that the data that was presented to the FDA, under which they granted the emergency use authorization, is relevant to our population. And think about that, 13%, 10.3%, 9.8%. So maybe that's an average of 10 or 11% out of 110,000 people. That's thousands of us were in this trial. So we should be confident about that and congratulate ourselves for participating in these trials and doing something that by and large hasn't always worked out in the best interest. You know, I won't even go into historical atrocities, but quite frankly, scientific research in America hasn't always worked out that well for us. So I think we can congratulate ourselves and have confidence in this data. And if you have chronic medical conditions, these vaccines are for you and your family. Protect yourself.
Definitely. And also, I just would love for you to touch on, everyone is like, oh, they rushed to do this. Can you tell them they did not rush to create these vaccines?
Yeah, so COVID-19 is caused by a virus called SARS-CoV-2, severe acute respiratory syndrome, coronavirus 2. That 2 is important. That lets the scientific community know, oh, this is the second time we've seen this. When did we see this before? We saw this before for the first time in 2003. We had a SARS outbreak, severe acute respiratory syndrome. At that time, because we had our pandemic response team in place globally, we were able to keep this off our shores. But it alerted the scientific world that we have a problem, because this is a worst case scenario when you have a virus that is transmitted by air. So just think about that. It's not it's not transmitted it's not fecal borne, it's not food borne, it's not water borne, it's not body fluids, all things that we can control and keep away from if we need to. It's air. Like, we are Homo sapiens, we're human beings, we require air. Like, we can't opt out of air. We breathe in and out 12 times a minute, every single hour, every single day. We can't say, you know what, I think I'm going to skip air this year. We've got COVID. Additionally, it's hard to contain free air. Like, we can't keep air in Europe. So this whole thing when Donald Trump was, I'm going to shut down the airline. We're not going to travel with, it's in Italy, it's in China. I'm going to stop people coming. It's just, the scientific world's just shaking their head like, I'm sorry, this is air. And so therefore we're behind the 8 ball. And so what I'm saying to answer your question is that was 2003. So very concerned. Lots of research started then. In 2012, we had a second outbreak called the MERS outbreak. It's also in the family of coronavirus. It's also airborne. The Middle Eastern Respiratory Syndrome, by and large, was contained to Saudi Arabia. So by the time we got to 2020, we had our first case of COVID-19 in the United States. We had 17 years of experience with this virus. We had completed all of the preclinical work, all of the bench work research. The spike protein had already been identified as a key nidus of transmission and even the method of action by binding to what we call ACE inhibitors, angiotensin converting enzyme inhibitors. That entire process had been identified, and all 30,000 base pairs of the genome had already been identified and analyzed. All that had been done before we even had our first case of COVID. So we didn't start at square one. We started with 17 years of research when that very first outbreak happened in 2003, and alarms started going off because this was an airborne virus. And we had to be on top of that. So in many ways, we were prepared. In many ways, we were not. We were sort of prepared for what would happen. We obviously weren't prepared for how we were going to manage it. A lot of that had to do with the administration that we had in place as well. So I think we should feel comfortable that this wasn't created overnight.
Right.
This was created behind the scenes. Lots of work is going on. Because we had a scare in 2003.
Yeah, so I've had that question a million times, and I wanted to make sure that we got that addressed. People need to understand this wasn't rushed. Please go get vaccinated. If unless your doctor tells you not to, please go get vaccinated. So Jewell, in similar to the prolonged grief disorder, are we possibly going to see PTSD from COVID-19 or from 2020 period?
We're going to see a whole lot, right? So, what we see most of is anxiety, particularly right now. And one of the things that, I love what Dr. Morgan just did, she gave us education, right? Like I sat here and learned what I thought I knew and realized I didn't even know all of this. So I didn't recognize that it had been going on for, 17 years. So that in itself, that lowers my anxiety, right? To say that, no, it wasn't a rush process. So I think that's one step that we can take. Finding ourselves and arming ourselves with the right information, the right data, what is going to allow us to feel better. Depression is also, going to be on the rise, whether that's with the loss, whether that's with grief, and all of those other losses that we talked about. And not to mention, we talked about some of those disparities, but looking at educational inequities, right? That was exacerbated during this time. So lots of students are going to be behind. That's going to have an impact on our family system, right? Because they're going to have to play catch up with that. And then, yes, we have that, stress disorder or traumatic, post-traumatic stress disorder as another component that we could be looking at. But honestly, there are so many things that can come out of this. And so it's important that, without even looking at a specific diagnosis, right? Because it does vary. We're all going to respond to this differently. It looks at our family history because it's important to know that it's not like, mental illness is just going to pop up, right? Just like a physical illness, there is still that qualitative and quantitative information that is gathered from whether it's you, your family, recognize if you have a family history, what your support system looks like, right? Even if everything else seems really dismal, if you have a good support, that can actually be one of the strengths that you need to feel protected and to feel safety. So I think in kind of looking at, beyond what specific diagnosis, but recognizing any mental health challenges, because, we also think about suicide.
I was just going to say, unfortunately, we've seen a lot of children committing suicide in this time because of, being away from their friends.
Yes. Yeah. And it's hard. And not even just being away from their friends. We also have to think about, school was an outlet and it was also a check-in, right? So how many families are, in domestic violence situation? We don't know what neglect has taken place because school systems are usually the ones to tag to say, hey, I think something's going on. Well, we don't have that. We had virtual school for almost a year where a lot of times either our students weren't coming to school or not engaging in the school system, didn't have access to the resources, or, just at this point, just could not get caught up, right? So there are just so many different things that, we're going to see that's going to bubble up. But also to look at, the pauses in it. I really encourage anyone, whether you were directly or indirectly impacted by the pandemic, just let's go find a paid friend, guys. Let's really seek out therapists and mental health professionals so that whether you think you have something going on at the given, you don't have to have an illness to talk to a therapist. So it's really that checks and balances so that someone can allow you to explore your thoughts, your feelings, really looking at those behaviors and actions and seeing how we can change those things around, I think is one of the first steps we can do to really combat, this mental health crisis we may be looking at. Just the check-in, that's the first step. Mm-hmm. And then, building up all of those other social determinants of health, because therapy can still help with that. It can help us organize. It can help us prioritize. So even thinking about, homelessness, if this is an issue for you, if you have evictions and it's coming, how do you prepare for that? What resources are in your community? Making sure food insecurity, if that is a challenge and you do not have access to food and you're relying on food banks or your schools to get access to food, making sure that you can connect with others to figure out how you can improve that, whether that's community support, whether that's with the legislators, policymakers. This is the time to have a voice and to advocate for what your specific needs are or those who are around you, right? So I think, looking at all of those different areas, engaging in mental health professional services, whether there is a challenge, imminent or not, doing that checks and balances so that we can effectively kind of process that, but also looking at some of those other challenges, looking at if you feeling helplessness, that you are actually talking and connecting with someone in the immediacy, so that you can make sure you have what you need to get through this, right? We want you to be here. And I know it may not seem like, you can get past this, but I promise you, you can. You have survived every single thing up until this point. So there is no reason we can't get to that very next step, even if we do it just one day at a time, one moment at a time. Connecting with someone is so crucial and critical at this point. And I know there's a lot of shame and a lot of guilt, all of these feelings that are normal that we're afraid to really talk about and to expose because we think we're the only one. I can say about one thing, we have experienced this, whether we were all in the same storm, right? We may have had different boats, different resources. We're in cruise ships. Some people are hanging on to paddle boards or just a buoy, just trying to get through the waters. But recognizing that we are all here and recognizing the support that is needed, the compassion that is needed, and the resources that you have. You have peer support if you feel that you don't have funding to get to a therapist. There are federally qualified health centers who have integrated healthcare, which means they look at your physical health and your mental health, even though we got one body, and I never know why we're separated, but that's a whole nother conversation. Right. But, making sure that if you had health insurance that was tied to your employee, what other resources are available to you? There have been some allocations with the different acts that have came out of federal legislation where COBRA has been offered. So making sure that you still know what that looks like for you. And then also looking at, different communities and advocacy organizations like NAMI and Mental Health America, American Foundation for Suicide Prevention. These are all different resources that you can tap into, different health providers, and at the very minimum, just starting with your primary care provider. Being open, particularly in communities of color. I have parents who I have to tell constantly, talk to your doctor about your mental health. If you feel that you're more depressed, if you feel that you're more isolated, have those conversations so that they can connect you, because it may be just, how you're experiencing it, or it might be an underlying other concern, right? There could be organic thyroid dysfunctioning. So any of that can also be tied to that as well. So just making sure that, you think about all of your resources, and when you do get to that point or that low, or if you're the person who's recognizing someone who may be at a low area, or who seems like maybe it does seem like it's a lot going on, because also check on your strong friends too, right? Even though they seem like they have everything together and they keep pushing and they keep moving it out, burnout is there, and we want to make sure that we can tackle it, and we want to just pause and say, no, really, how are you doing? You have done a lot. You have come with a lot. You are moving with a lot. And I know you keep smiling, but I want to make sure, are you okay? And can I connect with you? Who is taking care of you? And at the minimum, self-care, taking time, allowing yourself to feel emotions, whether that is going to be spiritual self-care, financial self-care, mental self-care. Anything, if you dedicate some time each day to focus on you, when you are really giving yourself, being a good friend to yourself is so important right now, because you know how you tell your friends, oh, you need to do this, and make sure you're taking time for you, right? Do that for
yourself. Yeah.
Right. So,
and I was going to ask you, because you mentioned parents real quickly, but for kids, what can the parents do, to open up the conversation or something? Because I think you have to start the conversation in order to figure out what's going on, to see if you need to send them to someone, or you just need to send them to someone, and because we've all been through it, like you said.
Right. Yeah, and definitely with parents, because I know as a mom of 3 boys who had to do that distance learning, work from home, it was rough, guys. Look, be kind to yourself and really engage. One, our children they really are struggling with all of this, right? Because of the separation from friends, because of is it really such a big deal, especially our young adults? But, it's also making sure that you can talk to them in a developmentally appropriate way, right? So making sure that, a 5-year-old is going to have a conversation different than a 10-year-old. But to say, how are you feeling? Let's recognize your feelings and help them to acknowledge what their feelings are too. Because sometimes they just don't know. Like, I just feel yucky. Well, what does that mean? Are you sad because you can't see your friends? Or, but really talking with them and having open and honest conversations and validating how they are feeling. I know it doesn't seem like, well, I really want to be with my friends, and you're probably thinking about, well, I need to make sure that we have dinner tonight. But really taking that time, that for that child, that's the only frame of reference. That is their world, is being connected to their friends. So just taking that time to pause and really focus on them, as hard as it is, I know it is. But it also forces you to slow down as a parent too, to say, hey, what's going on? Let's talk, let's snuggle, let's cuddle, let's just really get to know each other in that moment. And don't be afraid to have some of those tough conversations, even as we are dealing with some of the structural racism, and helping them to understand, because they see it. They're on social media, they're constantly surveying the internet, and it's a lot of things that doesn't make a whole lot of sense to them. So making sure we process that, right? And making sure we have those thoughtful conversations with them is so important for their resiliency, their mental health and well-being, and really asking those questions about suicide, because I know we think that the younger they are, they don't know, but they do. The youngest child I know here in Georgia was 4 years old that took their own life. So it's so real. And you think that, and there is a forensic investigation that takes place. So, having that, that comes from really with our Georgia Bureau of Investigation. Those are reports that they keep track of and that they report out on. So these are real things. And these are happening more so in communities of color, right, because of that lack of support, because of that, adverse childhood experiences, poverty, and our socioeconomic status in itself can be so limiting, and lack of community resources. So really take the time and really think about, what conversations do I need to have? And if you need help, at the minimum, reach out to your child's school, right? They have a counselor, social workers who are working to learn more, to connect with families. So at least start there if you just don't know where to go or where to start.
Yeah, I think a lot of organizations are doing that. I do a lot of volunteer work with the Girl Scouts, and they even have someone that they're working with that is helping them with conversations with the girls in Girl Scouts. And, Girl Scouts is an extracurricular activity. It's not necessarily tied to a school. Some are tied to a community, some are tied to a church, but they actually have somebody at the Girl Scouts that I work with. They have someone that is actually creating materials to help the troop leaders to have conversations with the girls, so that, in this pandemic, they've been meeting online, or they'll meet in an open air, area, but they've been trying to keep meeting because they do realize how important it is, because, they have girls from kindergarten all the way through high school. So that, every age is being affected.
And check your state departments. Some of those have a lot of resources, whether you're local to Georgia. Georgia has a COVID-19 support line that could connect you to different resources. But there are a lot across the world. They're really engaging and being very intentional, particularly when it comes to mental health. Engaging with children, if you want to learn how to talk more, there are some resources that we'll make sure that we get out to communities so that they'll know what that looks like. Even some videos to really help you with that as well.
Perfect. And Gabriel, I'm sure you guys have people on staff to, help people through this, because one thing is, once you're immunocompromised, the last thing you need is to add stress to that. So you really, and this has been a stressful time. So
yeah, I think what's taken up the majority of our efforts has been case management. It's surprisingly how just helping a person navigate all of the many systems, how much that can take up time. And so I know that that's where we're focused on, is really helping, as Jewell said, kind of pull all of these pieces together. And it's the mental health clinic, and then the case manager often has to follow up on that, because the steps to accomplishing those things that you may outline may have sub-steps within those steps, and Dr. Morgan highlighted it with the unfortunate nature of the healthcare system, that we shouldn't have to go in and explain ourselves, but oftentimes not coming in with your complete articulation of what it is that you need, it could make a difference between a 30-minute visit and 2 minutes spinning around in circles inside of a clinic, trying to figure out what program you qualify for, really being able to articulate if you need a specialist or being able to get to the right person that you need. It can be a whole performance, so I think helping our clients navigate that is really key. I think I wanted to also just highlight and champion the work of organizations like all of ours that are doing this work, because, I think what COVID did is it revealed, not only these disparities that existed within population, but it really was an indictment against our investments in public health infrastructure, the healthcare infrastructure, the nonprofit infrastructure. There were all these weaknesses from an organizational systems point that we haven't made the necessary investments, and now that I'm in the housing development world, and I'm looking at the kind of housing we build in America, and I compare that to the more cost-effective, aesthetically pleasing, environmentally empowering projects that are in places like in Asia or in Europe that are done in a cost-effective way. And it just sort of illuminates to me the dehumanization that has taken place over how we see poor people. And President Biden said in his speech earlier today, where he talked about the need for some taxation that's going to happen, and he said, damn it, I'm tired of seeing poor people be fleeced in the system. I think that was some paraphrasing, but it was this indignation about how we have treated those who are less fortunate. And I think us as community organizations, we play a vital role in the advocacy and sort of the activism that's going to be needed, so that all of these monies coming down, all this CARES Act money, rescue package money, future infrastructure bill to come, this is the golden opportunity. This is the Super Bowl for those of us in healthcare and in mental health and in public health. This is our Super Bowl. This is what we were called for. And so this is the moment where we need to be really advocating so that we can remedy these historical inequities to hopefully have a much more sure and stabilized future.
Definitely. And we had a question. Dr. Morgan, have there been any side effects from the vaccine that affect one's mental health?
So I'll answer that question in 3 layers. I guess the first layer is I'll answer the question directly. When we look at the data that went to the FDA for those briefing documents, there were no mental health effects of any significance. So that means that they were not listed as the top 30 or the top 40 things. And so the answer to that question scientifically would be nothing of significance. Significance doesn't mean that it's not important. In science, significance just means statistically, it didn't reach a certain percent. That's what it means. So I just want to be certain it doesn't mean that you are not significant. Significance is a statistical term. The second way that I'll answer that question is, regardless of what the data showed, if you think that the vaccine has caused depression, or you feel depressed after the vaccine, then you should report that. And there are a number of ways you can report that. You can download the V-Safe app and report it there directly to the government. You can go directly onto the websites of the companies, whichever vaccine you took, and report it there, or you can talk with your physician. And remember, it's not what your doctor thinks, it's not what your family thinks, it's not what the FDA thinks, it's what you think. If you think that the vaccine caused your mental illness, then you report it. It's what you think. And then the third thing that I will say is, if you develop a mental illness, whether it's related to the vaccine or not, then please seek help and make certain that you talk to your physician and you follow up with that physician or other healthcare provider and get the help that you need. So those are the 3 layers in which I would answer that question.
Thank you. So we have 7 minutes left. Are there any last minute questions from the audience? Anyone, please type those in, but I will, I'll start letting people say their last remarks. Jewell, is there any last remarks you want to give to managing our healthcare in the post-pandemic era?
Well, I just encourage people, one, to take the information and really take time to understand the importance of your overall health. Recognizing you got one body, your brain is connected, and that's the one thing that, it's controlling everything else, right? So really taking that time to focus on healthy strategies, and that includes your physical health. I know for the last year or so, we've kind of shifted away from, our health appointments, dental appointments, eye appointments. All of those are very key, because if, again, we don't take care of our health, then our mental health is also impacted. So making sure that we are intentional, and I have to just again reiterate the importance of taking the vaccine. I know, right? We're very scary of it, but I promise you guys, one time, taking care of you is the most important thing. And I don't know how many times we tried things that we could probably be a little sketchy about. That restaurant we keep going to that we just keep trying. We look at that health score and we keep going, but we keep doing it, right? So, think about it from professional scientists, researchers, the same faith that you have in going into these restaurants, please put it into our scientists as well, and really focus on your health, because your health is also going to impact those around you.
And Gabriel? Any
Yeah,
last minute remarks?
Yeah, my comments are actually directed to Black therapists, Black physicians, Black public health workers, Black community health workers, Black nurses, Black epidemiologists, Black researchers and scientists. In a post-COVID-19 pandemic, take care of ourselves. We have just performed a great feat, all of us in the health system, particularly Black people. We have done a great feat. And so one, I am honored to be amongst you all. I'm honored to be a member of the public health, core of America. And I really hope that all of us take moments to do our own reflections, do our own self-cares. I'm even doing a full wellness check. I'm going to go and do a whole body check, have myself pocked and prodded, just to get everything checked. I just want to be healthy, as Dr. Morgan had said, just being healthy overall. Go for a hike, do a meditation moment. As soon as you're fully vaccinated and guidances allow, take an appropriate vacation, take even a road trip, drive somewhere, go and do an Airbnb stay, but take care of yourself would be to my Black workers.
Mm-hmm.
And Dr. Morgan, any last minute thoughts, guidance on how we can please hopefully get out of this and start getting back to normal?
Sure. Vaccines are our path towards to regaining our lives. And so if we look at the 3 vaccines that we have available in the United States, we have Moderna, we have Pfizer, we have Johnson & Johnson. So which one is the best one? Which one should I get? Pfizer and Moderna have 95% efficacy and 94.5% efficacy compared to Johnson & Johnson, that's a 72% efficacy, meaning how well it works. But remember, the flu vaccine in any given year only has between 48 and 62% efficacy. The other thing that we have to remember in comparing these vaccines, we're comparing apples to oranges. The Johnson & Johnson vaccine was trialed with its 40,000 participants when all of these new and more virulent mutations out of the UK, out of the Brazil, out of South Africa were circulating. All of those mutations were in that trial. Those mutations were not in the Moderna and Pfizer trials because they had not developed yet. And so it's unclear how Moderna and Pfizer might have performed under similar circumstances. Johnson & Johnson certainly had a more challenging path. The longer we stay away from herd immunity, the more opportunity this virus will have to continue to mutate. We are the host in the life cycle, the human being. We have to remove ourselves from the life cycle of this virus. We do this not only by the vaccine, but by public health measures, covering your face, washing your hands, practicing social distancing. If the virus can't invade our bodies, it cannot replicate and it cannot mutate. Worst case scenario, we're concerned that a mutation could develop against the vaccines themselves if we continue to lag and we continue to chase this. So remember, when we're talking about 95% efficacy versus 72% efficacy, this is not math, this is science. And the two are equitable because they have 100% prevention of death, 100% prevention of hospitalization, and one was trialed against more virulent mutations than the other. This is not math. This is science. And so that's what I want to leave you with. I encourage everybody to get vaccines, whichever one is available to you.
Thank you. And also, please make sure that you know that the vaccine is free. So please go wherever you need to go, but you should not have to pay for it. The vaccine is free. They might ask you for your insurance card, and I forgot what do you know what the significance of that was?
I think identification, maybe.
Okay. Yeah. So, because I have been vaccinated.
You don't need identification either. You can refuse. You still get the vaccine.
See, this is why we have community conversations, so you can understand all your rights and know exactly what you need to do. But please go get vaccinated. Vaccination is going to be necessary to travel. I know people who have already traveled and you had to be tested 1,000,000 times to get out of the country and another couple times to get back in. So
and
you might as well just
of mutations. Right.
Pardon me?
That's because of mutations.
Exactly. Yes.
Right.
So please make sure that please go get vaccinated. And in the interim, so that we can stay healthy, remember to drink water. Exercise. And when I say exercise, you don't have to go to the gym, because I know a whole lot of people are afraid of the gym now. Just take a walk. It could be a walk around the inside of your house, the outside of your house, or whatever. Take a walk 30 minutes a day, 5 days a week. And it doesn't have to be a straight 30. You could do 3 sets of 10. Just get you some exercise. Dance for 10 minutes, but get some exercise. And make sure, if you have any of these underlying conditions, make sure that you see your doctors regularly and stay on top of them, because the last thing you need is to get exposed to COVID and your blood sugars are all out of control. If you're diabetic. So please make sure that we see our doctors. And another thing that we did notice in this pandemic is that a lot of Black people don't have primary care physicians. So let's try to change that. And there's all sorts of clinics that you can go to. And, so don't let insurance and money be a barrier. Make sure you have a doctor, because you don't understand how important a primary care doctor is until you don't have one and you're sick with COVID and they don't have a clue what's going on with you. You need somebody who knows your medical history better than you do. And if you have a primary care doctor, they have the files. It could be a simple phone call and they can figure out what they need to do to treat you to make sure that they keep you alive. So please, everyone, get a primary care doctor. Take care of yourself, self-care, as well as make sure you take care of your mental, your physical, emotional health. If you need to seek help, a paid friend, I like that term, Jewell. If you need to seek mental help, then please contact them. Silence the Shame will supply us with all sorts of resources, because there is free people you can talk to. You don't even have to go sit in the office these days. You can probably virtually speak to them just like this, and you can talk to someone and get some help. But thank you, everyone, for joining us this evening. Oh, Pilates with Dr. Morgan, I heard.
Pilates with Dr. Jayne. So I do have a Pilates online school. And I also have a scientific platform. You can follow me with Stairwell Chronicles. I answer one question about the COVID vaccine in 60 seconds or less. Sit on the steps and talk about it. I'm on Instagram, Twitter, LinkedIn, Dr. Jayne Morgan, Dr. Jayne Morgan. Follow me, and I just talk science. That's all I talk. I don't persuade anything. I just give you the data. I give you facts. We just talk science.
Thank you so much. So everyone, please make sure you go follow her, because I think that sounds like it's going to be some great information. The other thing, like Jewell said, you need to make sure you're getting factual information, because it will decrease your anxiety. When you start listening to people who have no idea what they're talking about, that's when your anxiety gets increased, because they're giving you misinformation. So make sure whenever you're trying to get this information, you get it from the correct sources, and don't inundate yourself with so much Turn off CNN at some point, because these numbers, unfortunately, right now, they're not really getting much better. So we need to just turn it off and take some time. Now, if you want to watch 5 minutes a day or 30 minutes a day, fine, but just don't watch it all day, because it's just too much. So I hope that this has been helpful to the community, and we'll see you next time at Silence the Shame.
Bye.
Bye.
Yeah.